Hello class, my name is Romik and today I'm going to be talking about exploring technologies to improve cystic fibrosis care provision. As I was reading through the article, I noticed that all the technologies that they were talking about falls under four of these categories. These categories are at-home patient monitoring, active self-management apps, wearable technologies, and hospital clinical-based technologies. All of these had their flaws, and I was able to deduce some of the areas for improvement. The ones that I was able to come up with was building trust between patient and clinicians, increase patient and clinical collaboration, promote goal-orientated data collection, personalizable apps, and active self-monitoring. In order to achieve the best result, I believe that technology should bridge the gap between self management, education, transparency between clinicians and patients, and health monitoring to provide the patient with the best results.
Hello everyone, my name is Dennis and I'll be talking about the methods and analysis section for Article 1. So one thing that I learned right off the bat was about the grounded theory. And this is how theoretical concepts are derived from data collection, which makes a lot of sense on how and why we analyze data the way we do. And within this observation or this study, they conducted clinical observations and interviews, which were then transcribed. And I like how they were transcribed and focused on a certain age group because that just made the analysis section that much easier. So with these transcribed observations and interviews, the data was then able to be grouped. So it was grouped off of themes, and then it was clumped, and then they become clusters and codes and themes. And all of these different keyword searches resulted in an overarching theme. In this case, it had three overarching themes. Pretty much, accommodating cystic fibrosis in every day, the challenges it presented, as well as perceiving value in technology. So I learned, a really efficient way on how to analyze a mass group of data and being able to analyze it real quick in an effective method.
So I'm going to be talking to you about the results of the first article. Prior to this article, I had no idea the burden that people with cystic fibrosis went through, but I learned ways in which technology can alleviate these problems. So people with cystic fibrosis take a lot of time and effort to manage their problem because they constantly have to take medication and go to the doctor's office frequently, but mobile reminders can help with this. People also use fitness trackers and fitness apps to track things like physical activity, which is really good for cystic fibrosis. They also use it to track nutrition intake, lung capacity, weight, and BMI, which clinicians find especially useful for early detection of illnesses. These technologies are also good for remote monitoring, which can reduce the amount of time people spend in the doctor's offices. I think these technologies are great because they keep people more aware of their health status and more engaged in their treatment. With the way technology keeps advancing, I have no doubt that these methods will get better in the future, and it'd be interesting to see where these technologies lead to when it comes to other diseases as well.
The article states, our aims were to understand current practices of patients and healthcare professionals and the factors shaping them, to identify challenges in CF care and any opportunities for reconfiguring these practices through personal monitoring technology. Cystic fibrosis is a chronic, life-shortening hereditary lung disease that requires individuals to continuously monitor their daily medication, physiotherapy, and diet. By utilizing personal monitoring technology, it will allow for better health outcomes by the multidisciplinary team because they will be able to see how the patient is doing with the treatment at home. Although the patient may feel that this is tedious to continuously monitor several factors, they understand that it is needed to further their quality of life. Personally, I believe that this is a very interesting article that explains how technology can be used to help healthcare professionals care for patients.
This article covers telehealth. Since my group's proposed solution in the hackathon was also telehealth software, I am familiar with the benefits and barriers to telehealth. Video streaming consultations allow doctors and specialists to connect to hard-to-reach populations, and insurance companies can offer reimbursements for such consultations. Telehealth can also make coordination between members of the treatment team and patients easier, so I believe that future widespread use is almost certain. The main barrier that this article identified was patient preference for face-to-face consultations. One criticism I have of this article is that patient preference was cited as the biggest barrier from the doctor's perspective. Doctors blaming patients as the reason they will not implement telehealth seems more to me like the biggest barrier is getting doctors on board with using telehealth rather than the patients.